we want to talk about today is the clinical workflow improvements that came to us with technology upgrade and alarm management. We obviously had outdated technologies with a lot of limitations between communicating to the clinicians that at times led to delay in patient care itself. There were a lot of downtime due to these old processes and technology in place that obviously interrupted the patient care.
So this is our current setup. When we opened the hospital in 2012, we put all these things in place. And this is what we integrated. Complete HP wireless system, Rowland responder nurse call system, Masimo pulse oximeters, Vocera voice over IP badges, ShoreTel IP phones, Connexall, and then the most important part of integration is staff buy-in, staff cooperation, and communication and education.
As part of setting up the whole system, one of the things that Connexall, along with Vocera, we worked on was developing a path. So if somebody is trying to look for a nurse on the unit, how quick can they get to them? And if you cannot reach the nurse because you don't know their name, how else can you ask the badge to reach this person? If they are not available, where should that call go? So that's putting communication, moving communication along much quicker than what we were used to, where you would call someone, nobody picks up the phone, you leave a message, and you hear from them the next day. By then, you probably don't need them anymore. So this particular case study is in a case where the oxygen level of the child dropped quickly, and it alerted the primary nurse where there was no response. It auto-escalated itself to the second level, there was no response, and the alert went to the third level, which is assigned to the charge nurse and the respiratory therapist at the same time. And from the reports, we saw that the respiratory therapist acknowledged the message. Then a new alarm from the same child went to the primary nurse as a low heart rate, at which time the nurse got to the room. The child didn't look all that great, pressed the staff assist button as part of nurse call instead of the code blue button, which should be, by policy, the medical emergency button.
Yeah, we use Connexall as a starting point. We also run Vocera reports. We pull ShoreTel if there's a code blue call for the overhead to kind of make the timeline and paint the picture of what actually happened. We also can pull video and see if the person said they did exactly what they did. And when this event happened, 2 or 3 nurse managers came to me and said, this never happens. They were like, there's something wrong with the technology. And we just kind of investigated and found out it did happen. And right there, if you see right there, that's Bensie's hand taking a picture of the screen. Well, we've been talking to Connexall briefly, and a couple things we've been actively trying to implement but kind of got stuck. So the code blue to Vocera badges and ShoreTel speakerphones overhead. So all our conference rooms, when the doors are closed, there's no overhead speaker in there, and they put their Voceras on D&D. So when they're in that room, the clinicians are in the room, they don't get code blues. So this has been an ongoing problem. So number one was to overhaul every room with speakers in the room, which was a lot of work and a lot of money, or try to get this piece working here. We got as far as we could, and then it became a limitation of ShoreTel. Lab results. Fire alarm system, we want to connect that to Connexall to do the kind of same thing, to alert everybody where the fire is, what area, and just so everybody kind of knows. And then the software code blue button. The desktop help button can also, you click it, can send codes to Vocera badges or to the overhead if I get that working. And any code, any kind of code.
One of the things we wanted to try and do also was integrate the lab results that are coming from the outside vendor, that if they did a routine draw and the site resulted back to us, if it was a critical result, to go to the ordering provider, and if they are not available, possibly go to the attending provider. We were just stuck at the area where the vendor lab has to now alter some of their messages.
And you notice the theme that it's not Connexall? They're kind of willing to do whatever kind of it takes.
There was a lot of lessons we learned. Some of those events that we talked about led for a group of people coming together, looking at all of the reports, and really, instead of blaming each other, looking at it to see where the improvements can be put in place. And sometimes it was IT walking away with, well, it's an electronic system, and why wouldn't it do that? Why wouldn't it say it? You should make sure that it's done. And we would walk away with work, and then there's clinical staff who are responsible to go and reinforce and reteach and do their part.
Connexall can kind of send a heartbeat or just a tap saying or a ping saying, are you there, are you there, are you there? And if that stops, Connexall can send out an email saying, this is stopped, you need to check this. So we implemented email alerts that it comes to us and the supervisor at night when we're not there. So if we don't get it, they call us and make sure we know about it.